the Sri Sathya Sai Institutes of Higher Medical Sciences, also popularly known as super speciality hospitals, are tertiary healthcare hospitals established by Sri Sathya Sai Baba to provide patient care facilities to all irrespective of caste, class, creed, gender, religion or nationality, totally free of charge. There are two super speciality hospitals, the Sri Sathya Sai Institute of Higher Medical Sciences, Puttaparthi, Andhra Pradesh, and the Sri Sathya Sai Institute of Higher Medical Sciences, Whitefield, Bangalore, Karnataka, India. Mission statement: the Sri Sathya Sai Institutes of Higher Medical Sciences follow the guiding principles laid down by Sri Sathya Sai Baba. Universal healthcare: healthcare should be available to all, irrespective of caste, religion, nationality, or financial status. Decommercialized healthcare: healthcare should be delivered free of charge. Human values in healthcare: healthcare should be administered with love. Spiritualization of healthcare: the aim should be to heal the patient in body, mind and spirit, not merely to cure disease. History: the Sri Sathya Sai Medical Care Division runs 5 medical institutions. The following table depicts the dates of inauguration of the hospitals under the Sri Sathya Sai Medical Care Division. The history of the hospitals goes back to November 23, 1954, when the foundation stone of the Sri Sathya Sai General Hospital, Puttaparthi, was laid. The hospital was inaugurated on October 4, 1956. The hospital initially had 12 beds. It catered mainly to the local villagers and devotees who would visit Sai Baba's Prasanthi Nilayam ashram. Treatment for inpatients and outpatients was given totally free and continues to be so to this day. The hospital has the departments of general medicine, general surgery, pediatrics, ENT, ophthalmology, dentistry, obstetrics and gynecology. Similarly, a general hospital was inaugurated in Bangalore near Sai Baba's ashram of Brindavan in 1976. This hospital, apart from the facilities available in the Puttaparthi General Hospital, has the facilities of urology, orthopedics, plastic surgery and psychiatry. As demands on the hospital inaugurated in 1956 increased, need was felt for the construction of a new building, equipped with all medical facilities. During the birthday discourse on November 23, 1990, Sai Baba announced that a new tertiary care, that is, super speciality hospital will be constructed. Within 1 year, the Sri Sathya Sai Institute of Higher Medical Sciences, Puttaparthi, was constructed and was inaugurated on November 22, 1991. The Sri Sathya Sai Institute of Higher Medical Sciences, Whitefield, Bangalore, was inaugurated on January 19, 2001. The latest addition to the list of the hospital has been the Sri Sathya Sai Mobile Hospital, which, as the name suggests, is a hospital on wheels. The mobile hospital visits villages in and around Puttaparthi and endeavors to bring healthcare to the doorstep of the patients. The mobile hospital received national recognition when it was awarded Commendation for Innovation in Transforming Lives Award by CNBC TV 18. Sathya Sai Baba was checked into the Sri Sathya Sai Institute of Higher Medical Sciences, Puttaparthi Hospital, due to health problems and left his mortal coil on April 24, 2011. Sri Sathya Sai Institute of Higher Medical Sciences, Prasanthi, Puttaparthi. The Sri Sathya Sai Institute of Higher Medical Sciences, Puttaparthi, has 300 beds and 12 surgical units, 5 intensive care units, 2 cardiac catheterization laboratories, medical and surgical wards and a 24-hour emergency unit. The hospital provides free treatment to all patients. On November 23, 1990, during his birthday discourse, Sri Sathya Sai Baba, while talking about the inability of healthcare access to the poor, declared that within 1 year a tertiary care hospital will come up in the village of Puttaparthi, which will provide high-end care free to all the patients. There are few who are ready to set up such institutions to provide free facilities for the poor. Therefore, from the start we decided to set up a 100-crore hospital near Prasanthi Nilayam itself. Even as higher education is free here, higher medicine also will be free. People spend some lakhs to get heart surgery done in the US. What is the plight of the poor? Who looks after them? If they go to the cities, they will not get even colored water. Recognizing this fact, We have launched this big hospital project. Whether it is heart bypass operation, or a kidney transplant, or a lung operation or brain surgery, everything will be done free. This has been decided upon from the very starting of the project. Sri Sathya Sai Baba. Sai Baba added that the hospital would be inaugurated on November 22, 1991. The first cardiothoracic operations were carried out successfully exactly 1 year later. The Sri Sathya Sai Institute of Higher Medical Sciences was inaugurated by Sri Sathya Sai Baba and the then Prime Minister of India, Sri P.V. Narasimha Rao, on November 22, 1991. The second phase was inaugurated a year later by the then President of India, Dr. Shankar Dayal Sharma, when the Uronephrology department started functioning. The super speciality hospital continued to expand, opening the kidney transplant program in 1993, Department of Ophthalmology in 1994, and in 1995, the CT scanner and vitreoretinal services were inaugurated. In 1999 the lithotripsy center was opened. Kidney transplantation is no longer offered in the hospital. Specialities equals. The hospital offers the following facilities: cardiology, cardiothoracic and vascular surgery, urology, plastic surgery, ophthalmology, orthopedics, gastroenterology, cancer. Academics equals. The hospital is accredited by the National Board of Examination, India to provide diplomate of national board training to doctors in the specialities of cardiology, cardiothoracic and vascular surgery, urology, ophthalmology, anesthesiology and orthopedics. The hospital has earned 2 gold medals in the DNB courses of urology and ophthalmology. Dr. N. Sridharan received the gold medal for DNB Urology in 2004 awarded by the National Board of Examinations. Dr. Amit Chhabra received the DNB Gold Medal for Ophthalmology in 2010. Departments of the hospital organize yearly conferences that are attended by faculty members and delegates from across the country and world. The hospital has periodic academic sessions in which doctors from the hospital and from outside share their knowledge on specific topics of academic interest with the doctors and students. SSIHMS, Puttaparthi also receives visiting professors from India and abroad who provide their expertise to the students. The students are exposed to a spectrum of cases, as the hospital is charitable in nature. The number of candidates admitted for training in this institute every year is 2 each for cardiology, urology, ophthalmology, anesthesiology and orthopedics. The DNB training for these departments is 3 years. 2 candidates are admitted to the Department of CTVS. The period of training in CTVS being 6 years post-MBBS. National Board of Examination guidelines are adhered to with respect to stipend, library, internet facilities etc. Going along the philosophy of Sri Sathya Sai Baba of free education for all, the hospital does not collect Rs 80,000 a year from trainees as training charges fee as prescribed by the NBE, since it is run by the Sri Sathya Sai Central Trust, which functions on the philosophy of Sri Sathya Sai Baba that education and health should be provided completely free to all. Conferences and seminars Departments of the hospital organize yearly conferences which are attended by faculty members and delegates from across the country and world. Most recently the Department of Cardiology conducted the Advanced Echocardiology Conference on October 11 and 12, 2014 in collaboration with GE Healthcare. This conference is part of a series on echocardiography conferences, which takes place alternately between the Sri Sathya Sai Institute of Higher Medical Sciences, Prasanthagram and Sri Sathya Sai Institute of Higher Medical Sciences, Whitefield. The faculty members at the conference included Dr. Alumni, former president of the Indian Academy of Echocardiography, Dr. G. Viraghavan, Vice Euro chairman and founder director, Kerala Institute of Medical Sciences, Dr. P. K. Das, Hod Cardiology of SSIHMS, Whitefield. www.youtube.com/SSIHMS List of conferences and seminars held at Sri Sathya Sai Institute of Higher Medical Sciences, Prasanthagram. Impressions Dr. Michael Nobel, great-grand-nephew of Alfred Nobel, Chairman, Appeal of Nobel Peace Laureates Foundation states, the world's hospitals are filled with expensive and advanced medical technology. It is also easy to find free hospitals. But the combination of the two, of a super speciality, highly advanced, state-of-the-art hospital which is free for the poor, that is a unique, completely unique concept. And if we add to that Sai Baba's presence, and the spirituality which his presence lends to the hospital, it becomes a very unique creation. I know hospitals very well, but I have never seen anything like this on earth. Anita Baduka, who was appointed by the World Health Organization as a member of the WHO Commission on Social Determinants of Health, visited the Sri Sathya Sai Institute of Higher Medical Sciences, Puttaparthi. Dr. Mitch Krukoff, an eminent cardiologist from Duke University, North Carolina, United States, talks about his experience with SSIHMS, Puttaparthi. There is an atmosphere of joy amongst the staff of this hospital, as they do their work. When we first went over to India, we thought we're going to this poor third world nation and share with them our technologies, teaching them how to use it properly. Honestly stated, this was a very arrogant start. Later, it turned out that we learned more than we taught. Building and architecture the hospital was set up on 110 acres of land near the Sri Sathya Sai Airport, and was designed by Professor Keith Critchlow from the Prince of Wales Institute of Architecture in London. The architecture is a mix of ancient Hindu and Islamic styles. However, some components of Indo-Gothic style could be noticed. The hospital has a built-in area of 153,000 square feet. The hospital has a large central building with a magnificent dome which is connected to 4 buildings on either side, each with a dome. Critchlow was given 3 months to complete the design and the hospital was built in 9 months. This, according to Professor Critchlow, is a feat only Sai Baba could perform. It is said that the construction of such a massive hospital with all its modern equipments would take more than 7 years even in US or UK. There are many interpretations of what the building represents. Some people believe that central building represents Swami's heart and the others with the connecting curved corridors represent Baba's 2 arms embracing humanity. The impressive building stands as a magnificent temple of healing. Its inspiring architecture imparts an aura of divinity and peace to all who enter the hospital for investigation or treatment and to those who work there. Spread over an area of 15,000 square meters, the hospital hosts 300 beds. The hospital, with its beautiful architecture and serene rural setting, serves not only as a temple of healing for the body but also for the mind and the spirit. Sri Sathya Sai Baba says of the building process, the firm of Larsen & Toubro are known for their big constructions in India and abroad. But nowhere else was such enthusiasm and zeal displayed by the workers engaged in the construction as in this hospital. Even the smallest worker did the work of 10 persons with zeal and joy. All workers performed their jobs with enthusiasm and devotion. There has been recent improvements since 2002 of rail transportation to Puttaparthi, one of the reasons being the Sri Sathya Sai Institute of Higher Medical Sciences, Puttaparthi. Sri Sathya Sai Institute of Higher Medical Sciences, Whitefield, the Sri Sathya Sai Institute of Higher Medical Sciences, Bangalore, was inaugurated on January 19, 2001. After its success, the Karnataka government offered Sri Sathya Sai Baba 53 acres of land to establish another super speciality hospital. The cost estimate was Rs 2,000 million. The Whitefield Super Speciality Hospital offers free care for cardiology, cardiothoracic and vascular surgery, neurology and neurosurgery. The hospital also has inpatient services such as radiology, laboratory, physiotherapy, dietary and counseling. Alanga S. Hegde, neurosurgeon in private practice and part-time director of the 330-bed hospital, said in a Z News interview, treatments, tests, medicines, food and hospital stay are all free. And if some tests cannot be done here, we get them done outside at our cost. On an average day, surgeons here perform 7 neuro and 7 heart surgeries. Together with laboratory tests, X-ray scans and outpatient procedures, these are worth over Rs 5 million in commercial terms but done free. Built with trust funds, The Rs 200 million that the hospital spends annually on salaries, medicine, equipment and maintenance come entirely from unsolicited donations from Sri Sathya Sai Baba devotees. The state government gave us land and the power supply for hospital is free, Hegde said. Companies give us medical equipment at discount and one computer firm installed Rs 10 million worth hospital software at no cost. The Sri Sathya Sai Institute of Higher Medical Sciences, Bangalore, is the second in the world and the first in India to have acquired the stealth neuronavigation system, the latest technology in precision neurosurgery. We have acquired this surgical navigation technology in keeping with the philosophy of Sri Sathya Sai Baba that the best Medicare should be made available to all irrespective of caste, creed or religion and at free of cost, said Dr. A.N. Safada, the ex-director of the hospital. During a visit to the hospital in 2002, former President of India APJ Abdul Kalam said, "I can see God's mission being carried out here. The doctors and staff look to me as angels." Ambience the Whitefield Super Speciality Hospital is actually known as a temple of healing as it provides Medicare in a spiritual ambience devoid of commercialism, its employees say. It is not just the state-of-the-art technology or high-quality service but the spiritual ambience pervading through the campus, says hospital manager. Sataranjandas Hegde says, "Those who man the gates, serve at the reception and counsel patients are all volunteers inspired by Sri Sathya Sai Baba's philosophy that seva, or selfless service, is service to God. People wanting to offer seva are so many that there is a waiting list for volunteers. We keep rotating them to give everyone a chance. It actually makes me feel I am entering a temple and not a hospital," said Akela Chandrasekar, medical director of Wyckoff Medical Center in New York. Dr. Michael Nobel has said, "I have never seen anything like this on Earth. It is a wonderful feeling, far removed from the national healthcare in the West, which does not seem to work very well." The impressive thing about the hospital created by Bhagwan Sai Baba is the combination of the three aspects: state-of-the-art technology, free medical treatment and the healing powers of his presence instilling in the patient the firm belief that he or she will get well. The hospital is managed by MBA graduates from Swami's Management Institute at Puttaparthi, who oversee all day-to-day activities of the hospital like admission waitlist, priorities, medical and surgical costs, and report to higher authorities. SIHMS Alumni Association, first annual alumni meet, Sai Vaidya Sangamam, was organized at the SIHMS, Prasanthegram, on 20th and 21st December 2014. The conference saw the participation of over 300 alumni of SIHMS, Prasanthegram and Whitefield cutting across the specialities from all over the country and abroad. The highlight of the meet was the formation of the SIHMS Alumni Association. SIHMS Alumni Association Office Bearers equals. Current statistics, Sri Sathya Sai Institute of Higher Medical Sciences, Prasanthegram, Puttaparthi, cumulative November 22, 1991 / October 31, 2014. Other information Sri Sathya Sai Institute of Higher Medical Sciences, Puttaparthi, plus 918,555-287,388 website, https://g.sims.org.in YouTube channel, YouTube COMS SSIHMS PSG LinkedIn, https www.linkedin.com Sri Sathya Sai Institute of Higher Medical Sciences. TRK NMP Rec Act Company Photo, Sri Sathya Sai Institute of Higher Medical Sciences, Whitefield, Bangalore, plus 9180-28,411,500 http, wfd.sims.org.in. References. Hi, I am from Siliguri, West Bengal. I was a heart patient. I want go to Sri Sathya Sai Medical Institute. External links, Sri Sathya Sai Institute of Higher Medical Sciences, Puttaparthi, Prashanti Nilayam Super Speciality Hospital, Whitefield Super Speciality Hospital, Sathya Sai Baba homepage.